have fears. Some quiet, some loud, some we don't even have names for yet. But fear, it's strange, has a strange way of changing depending on where we are. So let me ask all of you something. Are you scared right now sitting here? Well, probably not, because you have no reason to be scared, unlike me. But there's one place where fear isn't just a mere whisper. It gets amplified, and it echoes throughout the room. Now you might ask, where is this place, Tisha? But before I tell you, before I begin, I want you to do something with me. I want you to close your eyes just for a moment and with me imagine this. You step into a hospital and the smell hits first. Sharp, antiseptic, mixed with something metallic you can't quite place. Your footsteps echo down the corridor, louder than they should. Somewhere in the distance, a trolley rattles. A machine beeps steadily behind a closed door. The cold is impossible to ignore. It seeps from the very walls, the chair, the very bed beneath you, reminding you that this is not a place anyone comes to by choice. You sit on the edge of your bed, and everything is happening all at once. You're scared, and it's understandable. But what is actually happening to your body is something else entirely. Now, you realize something. The fear isn't in the procedure. It's not in the waiting. It's in yourself. And that is a space that I want to talk about today. You can all open your eyes now. In moments like that, there is often a phrase that arrives softly, carefully, almost rehearsed. I'm afraid we've found something. Not anything big, just 5 words. But the instant it's said, your body reacts before your mind even has the time to catch up. Now, your breathing, it changes. Your chest tightens. Your hands go still. And in that moment, you become acutely aware of your body, every breath, every pulse, every small sensation. Now, the question is, we measure almost everything in medicine, from vital signs to scans, but we do not measure the first things that patients feel. Now, it's paradoxical, right? Somehow, fear didn't make the checklist. We track heart rate and oxygen levels. We monitor scans, tumor sizes, cell counts. We analyze them down to their individual pixels. But the first and most immediate human response to diagnosis, that suspended moment before answers arrive, remains largely invisible. Now, fear doesn't appear on a chart. It has no standard metric, but it shapes everything that follows. How information is heard, how choices are made, and how that moment is remembered long after the room has become empty. So, I want to ask you something. Is fear just inside us, or do we just experience it because we're used to it? Now, fear has no standard metric. It is not logged, it doesn't exist in healthcare. But this is a fundamental concept in healthcare. So, this is not just something that I've come up with today. This is personal to me. Because when my aunt began going in and out of hospitals, she was scared. Appointments went and came without us knowing. Reports were folded and tugged away. And we had no idea how afraid she was. For months, this went on. Because she was scared of saying she was scared. And she was scared of saying what the truth would do to her and how it would affect the people around her. But this isn't what I've just noticed in my aunt. I've also worked on a cancer research paper where the goal was very simple, to help classify cancer types using molecular data. And technically, it worked. But whenever I thought about where those results would land, I thought about someone sitting on the other side of that data, someone refreshing their phone, someone holding their last breath in a hospital corridor. And that's when I realized that this wasn't just a gap in my project, it was a blind spot in medicine entirely. Now, this isn't just my personal observation. Science shows that fear is not harmless, it's powerful, it's measurable, and it significantly changes outcomes. So when we enter a hospital or await any medical sort of news, our bodies don't just sit quietly, they react. And this reaction is real. A large study published in the British Journal of Anesthesia found that over 80% of patients awaiting major surgery had experienced significant anxiety, even before treatment began. In many cases, this number rose to nearly 90%. Now, that anxiety is not just a feeling. Research showed by the American Psychological Association shows that anticipatory stress activates our sympathetic nervous system, the part of you that prepares you to react to danger. Heart rate spikes, blood pressure rises, your chest tightens and feels like you're going to collapse at any moment. People can even feel dizzy or nauseous. But this reaction, it's not weakness. It's your own body trying to protect you. But in a medical setting, these protective reactions can actually make care much, much harder. When people enter surgery tense and fearful, anesthetic can be less effective, and stress hormones like cortisol levels surge, which slow healing significantly. Fear also changes the way we think. In the Nature Review's Neuroscience publication, it was shown that people that are awaiting major preoperative surgery actually undergo major anxiety. And now that causes patients to appear to understand instructions in the moment, but in reality, when you ask them to say those information again, they struggle. Not because they were not listening, but because fear disrupted the brain's ability to withhold that information. Fear also changes the way we behave. It causes people to cancel appointments, avoid test results, cancel procedures, and also stop taking medication entirely. But in some cases, it actually does the opposite. It causes self-medication, a cycle wherein fear leads to uncertainty, uncertainty leads to avoidance, and avoidance deepens the fear. Now, these patients also required 67% more anesthesia, reported higher pain levels, and had very slow recovery times than patients who did not. So the data is clear. Patients who have anxiety require much more medical support than the ones who don't. But today, I want to ask a question. What if we treated fear as something real, an actionable and measurable part of healthcare, not like background noise, just like temperature or heart rate? Because when we do, it changes outcomes significantly. Now, this is what I like to call crisis-centered commitment, CCC. And there are 3 C's that I want you to remember whenever you see a patient awaiting any sort of medical assistance. First, capture fear, clarify uncertainty, and create comfort. First, we begin how to interpret fear, and we begin a shift in how we interpret it. Now, fear is not a side effect of illness, it's a signal. And once we learn how to respond to it, we can actually treat it as an actionable part. Today, we already have ways to capture it. Wearable devices can detect subtle changes in heart rate, oxygen, and stress levels long before a patient finds the words to describe how anxious they actually feel. But capturing this fear is not enough if we do not address uncertainty. Research has found that patients who were explained what was going to happen to them next in surgery reported much lower anxiety. Now, this can actually be a very simple part of healthcare. Clear, simple explanations, a few intentional moments and minutes required to explain to the patient what is going to happen next. This report significantly lowers their anxiety. And the third, beyond explanations and data, care must create comfort, not through therapy sessions, but through design, through trained navigators, pre-procedure conversations, and things that allow the patient to feel reassured, to feel seen before being treated. And once we do all of this, it also changes how clinicians are supported in the system. When fear becomes a real clinical signal, it's transformative. Patients are reporting much highly lower anxiety. And these things are what makes our medicine great. And just like with these steps, medicine not just becomes more advanced, but more humane. And that is a space that I want to talk about today. Now, this isn't just some theoretical thing that I came up with today. It's already happening. At a tertiary care hospital in Europe, a surgical procedure, people awaiting a surgical procedure required a structured conversation with a trained nurse 24 hours before the surgery. They were told what to expect. They were answered all their questions, and they acknowledged fear directly. The results? Striking. Patient-reported anxiety dropped by nearly 50%. This shows how simple things like breathing techniques can actually significantly lower anxiety. Now, these patients required less anesthesia, reported lower pain levels, and were discharged earlier on average than patients who received standard care. So if they can do it, why can't we? See, fear will always arrive first. It's our choice whether to ignore it or start designing care around it. So I want all of you to think back to that hospital room, the humming lights, the quiet, the cold, the body bracing itself before answers arrive. Now that is not theoretical, because all of us at some point will be one of them. So if we continue designing systems built for clarity, we fail people at their most human moments, their most vulnerable ones. And this is how medicine can become advanced. Right now, medicine is built for rational and calm patients, but real patients are frightened. They're unsure. They don't know what's going to happen to them next. So I want all of you to leave with one question. What if we treated fear as the first biomarker? Because when we do, people stop fearing healthcare, and it starts becoming something they can trust. And because all of us are going to become not as future teachers, doctors, or engineers, but as future patients, caregivers, and human beings. This is how fear should be the first biomarker. Thank you.